and welcome back to Sickle Cell Sundays. This week I wanted to run through what happens when I'm actually in hospital. Just a quick reminder that this is my personal journey and every warrior has a completely different experience. So there are different types of reasons as to why sickle cell warriors can end up in hospital, but the main reason is pain. First things first, there are many different types of pain which can actually lead to admission. There are three main types of pain: acute pain, chronic pain, and nerve pain. So acute pain is what I usually end up going into hospital for. This is a short-term pain which usually resolves within a few days, maybe a couple weeks. And this is a type of pain which develops from a vaso-occlusive crisis. So that means when sickled cells get blocked in blood vessels, and then this will slow down blood flow or cut off blood flow completely, and then this can cause tissue damage and lead to pain also. That is my main type of pain, and it's usually a pain which comes on randomly and suddenly, and it comes on at full force. It's so painful that I would just need medical treatment straight away. Or sometimes it's a pain which kind of like is lingering for a few days, and then I just cannot cope anymore, and none of my medication at home is working, so I need to go into hospital for stronger pain relief. So it's that type of pain. And then there's also chronic pain. Chronic pain is a long-term pain. So the cause of chronic pain is kind of unclear, but research suggests that it's probably due to repeated pain episodes, which then causes chronic pain. Chronic pain lasts for months. It can be the same pain, same location, and it is an absolute nightmare to get rid of. And then that can also lead to nerve pain. So nerve pain is caused by nerve damage, and this is usually when blood cells block blood flow to nerves, and also it can also be caused by pain crisis, which then causes inflammation around nerves, and then that causes the pain. So those are the three main types of pain that can land you in hospital as a sickle cell warrior. So first things first, when you go into A&E, is that they try to get IV access. So a phlebotomist or a doctor or a trained nurse will try to access your bloodstream through your veins. Usually they use something called a cannula, which is a small plastic tube that they leave into your veins. So it's actually the method of injecting a needle into your veins, and then they take the needle out and they leave the plastic tube in. It's really good because through this plastic tube, you can administer fluids and medication, and you can also take blood from it. So I will usually get fluids to rehydrate me just in case I'm dehydrated, and that is what's caused my crisis. And I will always get blood taken as well. Bloods usually depends on what the doctor might want at that present time, but usually they'll do a full blood count, which will then check your HB. Your HB test measures how much hemoglobin you have in your blood. Hemoglobin is an iron-rich protein which is found in red blood cells. And red blood cells is used to carry oxygen all around your body to your organs and tissues, and then transport carbon dioxide back into your lungs. So it's a really important test. And sometimes individuals might have a low HB, which might mean that they need a blood transfusion to help them get better. They'll always do a CRP test also, and this is to check your infection markers, just in case you have an infection and this is what's caused the crisis. That way they can also prescribe antibiotics if need be. So the main reason why I go into hospital is for pain relief that I do not have at home, and other interventions that I can't do at home. But with medication, it literally depends on the hospital that you are at, because different hospitals have different protocols for sickle cell warriors. For example, what medication they like to give and what interventions they like to do. And it also depends on if I go to hospital with the paramedics or if I just go to hospital with my parents. So I like to call the ambulance to come and collect me sometimes, just because they can provide pain relief for the journey, and usually the journey is the worst part sometimes because you just feel so helpless. But it depends on how I feel. If I just feel like I need to get to hospital in a rush, my parents will take me. But if I feel like I can wait for the paramedics, then I will call the ambulance service, just because with the ambulance it can be quite a wait. They're so busy. NHS is very short staffed, and it's really sad actually that it is short staffed, but sometimes it just takes a bit longer, so I might just need to go with my parents, if that makes sense. But if I do go with the paramedics, they will provide a gas called Entonox. Entonox, also known as gas and air, also known as laughing gas. So Entonox is a mixture of 50% oxygen and 50% nitrous oxide. It is a rapid onset of pain relief, but we cannot use it for long term because it can cause nerve damage. It's literally beneficial for the journey from your house to hospital, and that's it. They will discontinue the Entonox once you get to A&E. Entonox is good. It's a good gas, like it works. It makes you feel really drowsy. Like it's quite scary because you're taking in the gas and you feel yourself kind of like dropping, like
Okay, I'll speak for you. You're heavily drowsy, and sorry. And currently, the ambulance crew are doing a handover for Gilda. She's currently on, is this gas and air? Gas and air, which is making her very drowsy. Sorry? Oh, sorry, laughing gas, which is making her extremely drowsy. And they gave her morphine. And in the ambulance. She's not able to take another one for a little bit. Are you still in pain?
In an hour.
In an hour.
Which is really annoying because I'm in pain.
Which is really annoying because she's in pain. But she has to wait. Hopefully they'll give her something else.
A&E take forever.
But A&E take quite a while to sort her out.
And you can hear people around you, but you can't really, like, you're not with it kind of thing, and it's really scary. But I mean, it works for the pain. It doesn't take away the pain, it just kind of masks the pain, which is really annoying, and the one thing I don't like about Entonox, because once you stop blowing that gas and it starts to wear off, you can feel your pain slowly creeping back, which is what I don't want. It's really annoying. So I'm there blowing this gas in, like, just trying to get rid of the pain. But yeah, it's a good gas. I mean, it works, but we just can't use it for a long period of time. It can be very dangerous. But yeah, so after the Entonox, I will go into hospital, and depending on what they prescribe, sometimes I will get morphine and sometimes I will get diamorphine. There is a difference. I prefer diamorphine. I feel like it's stronger and it works better for me, but just hospitals don't like to administer it anymore because it's just worse compared to morphine all around in terms of withdrawal symptoms, side effects, just everything. And the side effects for me is much worse. Like, I will be nauseous. If I don't get anti-sickness, then I will probably throw up. Ew. I can't go to the toilet because it just causes like like, I don't want to say a blockage, but it causes me, it's just very hard to go to the toilet kind of thing. I can't wee. And also it makes me very, very, very itchy. If you've been to A&E with me, I have probably asked you to scratch me. Scratch my back, scratch my arms, scratch my legs. I'm so itchy to the point I want to rip my skin off. I think I'd rather be in pain than have diamorphine sometimes, because the side effects are horrendous. Horrendous. But anyways, so I will get morphine or diamorphine subcut. Subcut is an injection into the fatty part of my arm. So it's just an injection in between, underneath the skin, in between the skin and the muscle. Subcut is a preferred method just because sickle cell warriors basically have veins which are either really damaged or non-existent. So they'd rather preserve your veins and try not to use them just in case of an emergency. And so much puncture to the veins can also lead to scar tissue, which is not good also. My veins are not great, and I need to try to keep them for my blood exchange because I need them for then. So we use subcut. I don't usually ever get IV, which is intravenous. I don't usually get intravenous pain relief, but some warriors do. I always get subcut. Sometimes instead of jabbing me with a needle, they will leave a butterfly in my arm. Well, we call it a butterfly, but I don't know the actual name. Maybe a venflon. And it's basically just a plastic tube which goes under your skin. And instead of just keep on injecting you with a needle, they can put the medication through the plastic tube, which is really helpful because it's less painful. Yeah, I really like that actually. It works well. But apart from that, so I will get morphine or diamorphine every 30 minutes in A&E. If I go to the day unit, so I have a day unit in my hospital, which is really good. It's basically where you can go for pain relief that you don't have at home. And instead of going to get admitted onto a ward, you can go home after if you're all okay, which is great. So in the day unit, I will get morphine subcut every hour. And again, the same with A&E and the day unit, they will come and reassess my pain about every 30 minutes and decide whether I need more or less, or just what the next steps will be. So after the continuation of morphine or diamorphine for a few days while I'm an inpatient, then when my pain starts to get better, they will start to wean me off the injections and put me back onto oral morphine, which is what I have at home. And then when I start getting my oral morphine, they'll start preparing me for discharge, as I'm probably be a bit better to go home now. But apart from the pain relief that I get, also in a hospital, you will get your regular medication. For example, if you are on Pen V or folic acid or hydroxycarbamide, and other pain medication. They will always use other pain medications as well as the subcut medication. For example, tablets, paracetamol, codeine, ibuprofen, all of that. And if you have an infection, they will prescribe antibiotics, which you'll also be taken orally, or it will be intravenously through your veins. But apart from that, oh yes, I'll also get my side effect medications. I think I mentioned it, but I can't remember. So the anti-emetics, which is the anti-sickness, and the antihistamines, which is for side effects. If you have a rash, itchy, anything like that. But yeah, pain relief and medications. So depending on what you're going to A&E for, I usually go into A&E for tummy crisis or chest crisis. If you go in complaining of any type of chest pain, they have to do an ECG and a chest X-ray. This is to basically rule out any other chest complications, for example, pneumonia or acute chest syndrome. An ECG is an electrocardiogram, which is a test to check your heart rate, your heart's rhythm, and your heart's electrical activity. They do this by attaching sensors to your skin and then attaching wires to the sensors, and then they press a little button and this machine prints out this paper, which then has, I don't know, a graph, should I say, of your heart's electrical activity and stuff like that. I don't know how to read it, but the doctors do, and then they can see if there's anything else going on. And then an X-ray is a quick and painless procedure commonly used to produce images of inside the body. It's there to look at your bones and to see if there's also any other complications happening inside your body. It's amazing. Technology is amazing. Don't know how they thought of this stuff, but for an ECG, if you go with the paramedics, they will do an ECG in the ambulance before you move to go to the hospital, which is absolutely amazing because it saves so much time when you are in A&E. It's just one less job for the nurses and doctors to organise also, as they are so busy trying to gather up your medication and all your other information. So it's great that the paramedics can do that too. Also, I'm on the exchange program. So when I go into A&E and then I get admitted, if I have an exchange coming up, I will get it while I'm there. So the exchange is an amazing blood program, which they basically take out my sickled blood from my body and replace it with new healthy donor blood, all at the same time through this like big machine. It's really cool. It's amazing. I don't know again how it happens, but it's absolutely amazing. I thank all blood donors who donate blood. You're basically saving my life. And I've been on the blood exchange for maybe since October. I don't know how many months it is. Since October, and I feel like the blood exchange has actually really helped me. I've not been going into A&E as much as I used to, which is absolutely amazing, thank God. And yeah, so if I'm there, I will get a blood exchange. Some people have just normal blood transfusions, where they just basically add healthy blood to you, but it just depends what you have again. And then also while I'm in hospital, I will get oxygen therapy. So with oxygen, I don't really know how it works in terms of preventing a crisis. I tried to do some research, and a lot of the journals that I was reading basically said how oxygen therapy might not be beneficial. So I'm not sure. If you know, let me know, so then I can learn too as to how it helps prevent a crisis. I understand if you have low saturations, and saturations is basically a measure of your blood oxygen, or how much hemoglobin is bound to oxygen, and then it tests it. They put like a probe onto your finger, and then it comes up on this machine as to what percentage your oxygen is. So I understand if you have a low oxygen saturation, maybe below 94%, 95% maybe, and they want to basically increase your oxygen saturations, which is why they prescribe and administer oxygen that way. But I just don't understand how it helps prevent a crisis from happening. So yeah, if you know, let me know. That is about it. So I go into hospital for more or less acute pain, and then I will go in to get stronger pain relief and different types of medication. I'll go in for fluids and blood. I'll also go in for an ECG, an X-ray, blood exchange, and oxygen therapy. So to some of you, it might not seem like that much, but if you really think about it, it's a lot, especially for the workers. Providing pain relief every 30 minutes to an hour is a very demanding thing, especially to get it checked over, because all these medications need to get double checked as they are controlled drugs. And the NHS is very short staffed, which is very unfortunate. And it's really weird, because I see it from both perspectives. As I'm a nurse, even though it can be very frustrating sometimes waiting in A&E, I understand that we're very busy altogether. Like, it's just such a busy place to work, and there's other patients there, and I need to remember that I'm not the only one. Everybody else is also probably suffering too, and I don't know what's going on in other people's lives and stuff. So it's really weird being a patient and also being a nurse kind of thing, because you see like the whole experience, if that makes sense. But yeah, I'm just very grateful for the NHS for looking after me for my 25 years, and they've absolutely been amazing. I love the NHS. And yeah, so I hope you learned something new. I hope you enjoy the video, but that's about it. Hope you have a good week. Peace, love, and cure.